Hi, welcome back to Rohrich Knose. I'm Dr. Rohrich. I'm a board-certified plastic surgeon, and February is Heart Month. This is an incredibly heartwarming topic we're going to talk about. It's saving your heart. So I have an amazing provider with me, Chris Suprun, who is going to talk to us about saving your heart, your loved one's heart. So, Chris, welcome. Tell us a little bit about your background and why you're such an expert in this area.
Thank you for having me. I've been teaching CPR since the 90s. It was kind of my first love that got me into EMS as a paramedic. I've been a flight paramedic. I taught for the George Washington University back east, and I've been in Dallas for roughly the past 20 years.
That's awesome. That's awesome. Yeah. And, of course, he teaches all of my nurses and our physicians at Dallas Plastic Surgery Institute, and he's got the magic touch for teaching. You know, he's a consummate natural teacher. So tell us about what really happened to Damar Hamlin. I mean, you're talking about the heart, and what really happened and why that's so important for every one of us to know.
Well, there's two things that happened. One was a condition called commotio cordis.
And what is that for people that...
Well, it's a condition that doesn't normally happen to adults. We see it much more often in children when it does happen, but it's a very rare condition where the heart itself is impacted by a baseball, by a hockey puck, by lacrosse balls.
So something hard, high velocity, right
usually
in
high
the
velocity,
heart, right in the heart, yeah.
Strikes the chest near the heart at a very specific time, and we're talking about milliseconds, not so very micro parts of this minute. And when this happens, it disrupts the heart's ability to get ready to fire again naturally.
So it's happening at the last part of the wave. And I think it's
correct. Well, what you and I would call the T wave.
Right.
When that refractory period is happening for medical providers, we know that's when we don't want to defibrillate. If we're doing a synchronized cardioversion or something of that nature. But for the layperson, what they need to know is this is generally very rare, but we saw it live on national TV in the Cincinnati Bengals Buffalo Bills game with Damar Hamlin.
Right. Yeah, it was dramatic. So tell us a little bit about it. I mean, they were there immediately. It was like almost an ideal situation. Of course, it was covered by millions that day.
It's a tragedy that it happened to Damar Hamlin, obviously, but at the same time, it's a great benefit for the rest of us because it shows the power of CPR. Right. That when a provider is what we call bedside, next to the patient immediately, which we had a medical trainer with the NFL, on staff and ready to go within 20 to 30 seconds. We had a defibrillator bedside, so to speak, within about a minute. And they were able to do CPR immediately and defibrillate, which means stop the heart so that it can regain its natural pulsation and electrical activity very quickly. So while they were on the field for 9 minutes, this was almost a perfect example of everything going right. And this is everything the American Heart Association has told us for more than 20 years we need to do to have a successful cardiac arrest outcome.
Right. So tell us, for obviously the parents have called, some of them have called me and said, well, can this happen to my child in sports? Tell us about that. This is a rare event.
This is a very rare event. I think we're talking less than 5-6 occurrences per year. I know of...
In the United States.
In the United States. I know of less than 200 cases total in the studies I've read. They're all retrospective, and that includes adults.
And that's mainly in baseball,
hockey, karate, lacrosse, things of that nature.
So direct impact.
The hard direct impact. In baseball, at the high school level and below, in most leagues I know of, they have mandated certain chest protectors for catchers and other positions on the field so that the impact of a ball hitting the chest is deflected. I believe the same thing is happening in hockey. Obviously in karate it's a little bit different. I don't know what protective gear they're using there or in lacrosse, but it's very rare.
Okay, so tell us about what each one of us should know. The gift of the heart. It's February, so what can we all and should know about CPR? Every one of us should know that the trainers who responded to Damar Hamlin are exceptionally well trained. They're exceptionally well educated. But this is an incident they really don't practice. They prepare for ACL injuries. They prepare for broken bones. Cardiac arrest is not what you would call in their wheelhouse. And again, they did a great service to him and the NFL community and really the HeartSafe community simply by acting. So the first thing I always encourage the lay
person to do is be willing to step up and act. Too many people stand by, they see something happening, whether it's at the mall, on the side of the road, somewhere else, and they won't even pick up the phone and call 911.
Right, I know. I think I related this to you. I was at North Park. My daughter called me and she said that somebody had, fallen in front of a store. I don't know if it was because of the bill, but basically I got there and there's a lot of people just watching, and so I had to go there and initiate CPR. I mean,
and these are spectacles. I get that these are surprising events, but again, the person who steps up in those events on the airplane,
but it could be anybody.
It could be anybody, and do some basic things. Number one, call 911. In a number of places, 911 will walk you through the steps of CPR over the phone. Second, the steps of CPR for the layperson have been vastly simplified. We're primarily focusing on chest compressions only, so hands only CPR. There is no mouth breathing where we're breathing into the patient unless you're a healthcare provider. But these are basic actions that anyone can take immediately if they're willing to step up.
Okay, so what are those simple steps, the ABCs, and tell us exactly what all of us should know to save our loved ones or somebody that is in need.
Absolutely. Well, when you and I got into medicine, it was ABC. We were talking about airway, breathing, and circulation. What we know is, since that time, the science has showed us that most adults experience cardiac arrest because of a blockage in a coronary artery. It's not because of a lack of oxygen in most cases. They have plenty of oxygen. It's in all the wrong places, but it's sitting there in their bloodstream. What we need to do is push the chest and get that moved around so that the patient has an increased likelihood of responding to defibrillation, if that's a possibility. If they are in a heart rhythm, what we call a heart rhythm we call ventricular fibrillation, which happens when the heart acts like jello. It's kind of, again, I always use the jello example because that's the best one. The electrical activity is disorganized and it's happening in hundreds of different places in the heart at once. In those cases, we need to do two things. First, we need to go get an AED and call.
What is that? So before we do that, you come on somebody like a mannequin, he's pulseless. So what do you do? I mean, what do we do today?
We're immediately going to look for signs of life. If he's not showing us any signs of movement, etc., we don't even stop to see if he's breathing. We're going to immediately go to a point where we're going to put hands on his chest and start doing CPR.
Well, what about, do you check for a pulse? Or?
The layperson does not need to do that. Studies show actually that the average person can't find a pulse very well. They use their thumb.
Really?
It's kind of complicated, so there's no need to take those extra few seconds.
So what if they do have a pulse and you're doing CPR? I mean,
usually those patients are going to react and let you know that they don't need chest compressions, which is fine. That's what we want. If they're reacting, then we know they are somewhat conscious and can
because
react.
As a physician, sometimes when I've come across them and they've had a pulse, then it's a completely different course.
Absolutely. But you and I are at different levels of care. We've got many, many more steps that we need to do.
So signs of life.
So we're going to look for signs of life, any kind of motion, movement, obvious gagging, breathing. If they're gasping to breathe, we might try and make a quick evaluation. Are they choking? But by and large, we're going to start doing CPR.
Okay.
Using our hands only. We're going to call 911 and call for an AED. Now, an AED is an automated external defibrillator. It will shock the heart for the layperson so that we don't have to look at heart rhythms, so we don't have to evaluate the heart rhythm in any way. The machine does all the work, and actually it will explain every step of the process for you.
Right, and we're going to show you that as well, to just show you how to do it. And it's actually everywhere. It's on all the malls, it's in the stores, and it's supposed to be on all planes. Not always there, but it is. So you do that, and you call 911, and then you begin, and you're by yourself. And there's nobody there to help you. So what is the sequence of what you do?
When you're doing CPR by yourself, we also know that after about 2 minutes, CPR is physically very demanding. So we're going to try and call for help while we're pressing on the chest and get someone else involved. And when they say,
and why is that? Because what is the ratio? What do you?
Well, number one, I'm going to get tired very quickly. Now, in terms of ratios, we used to talk about doing 5 compressions to 1 breath, or then it became 15 compressions to 2 breaths, and now for you and I, it's 30 compressions to 2 breaths. For the layperson, we really just want them to press on the chest. And if they're pressing on the chest, they're doing what they need to. We don't need to worry about respirations. Again, there's plenty of good oxygen in the body. They're not becoming medically acidotic for up to 8 minutes.
So compression on the chest,
roughly to 2 to 2.4 inches, 100 to 120 times per minute is our goal.
Okay.
Again, that's very physically demanding on a mannequin, on a human being with musculature, and
It's even more so, right?
it's even more so. Maybe I don't even have that much muscle. I'm sure pressing on my chest would be even more difficult because I don't have the most heart-healthy diet. But when we start that process, we're going to need to get another bystander to help us. And when we do, as soon as they say, how can I help? We're going to instruct them, do the same thing I'm doing. Put your hand here, press your hands on the chest like this. We want to go as...
Well, show us on the mannequin how
Sure.
you would tell us that.
Many of our patients we experience are either the frail elderly, that's what I tend to see, and unfortunately, children do suffer cardiac arrest. When we do this, our hand is going to go on the sternum, on the lower third. We're going to use one hand on a child, two on adults, but we're going to compress straight down. Our shoulders will be over the sternum, and we're going to go 2 to 2.4 inches on an adult. Now that's roughly the correct depth. I am not presenting perfect form. The table is at table height. Normally we'd put a patient on the floor. We want to get them out of bed. We want a hard surface behind them. And ideally our shoulders will be on top so that we create a 90-degree angle.
Right.
Our body weight is pushing down on the chest.
And you
so
want to do
that
it
we
in a
can-
solid surface, not in a bed or anything. And
They need to be moved off the couch, out of a bed, out of a chair, whatnot.
on the
if we have to-
floor, and
on the floor.
on a plane, we put them in the center aisle. And
Correct.
okay, good. And then how long do you proceed with that? And you're obviously alternating, so you're doing 30 and 2, and obviously you may have a mask on a plane, or even by the time somebody comes to help you, right?
And if you've got a medical provider and you want to do oxygen and you have oxygen therapy available, you would do 30 compressions and 2 ventilations alone. Once you have that second provider, we switch to 15 to 2. So 15 compressions to 2 ventilations. The goal is still to get 100 to 120 compressions per minute. Again, things I like to always remind people is we need to go down to produce forward motion of the blood, but that mostly happens when our hands come up. So our hands need to come back up, not off the chest, but allow full chest recoil.
Okay. And so you proceed to do that, and if you're one person, so hopefully you'll have called 911 and somebody is there to help you.
Sure. We're going to call 911. I'm going to put them on speakerphone. I'm going to start doing compressions. As best I can, I'm going to try and both count as well as tell them where I'm at. I'm at 123 Main Street in Dallas. I've got a cardiac arrest in progress, an approximately 40-year-old male. I need a CPR response. I'm going to expect, and in most big cities and most suburbs, I'm going to expect both an ambulance and a fire engine who's going to help with CPR. Many fire engines in big city and suburban departments have paramedics on them as well, so they will start IVs, they will look at heart rhythms, they will administer any number of medications.
And they'll put on the AED. Tell us
They'll put
about
on
that.
an AED as well. Again, the AED is a great device. It's been around at least since the 90s.
You want to show us what that looks like? And
Yeah, you'll see a box like this.
Yeah.
There's a number of different brand names, but they all function very similar.
right.
Ultimately, the device itself, again, is generally very simple. It's going to have an on-off button. Some will have a shock button as well that will tell you when to shock.
So you don't put it into motor cordicus.
It's not even so much that, but there's a safety issue that we need to consider for ourselves as lay responders to not injure ourselves.
Right.
We want to make sure that everyone is clear before we shock.
Right, and
the
dry
machine is going to remind us of
Right,
that.
exactly.
So the first thing we need to do is turn it on. When we press the button and turn it on, as you know, it's going to say place pads of the patient's bare chest. I'm going to take pads out. These pads are perfect for what we are going to do because they connect to the device in such a way that they can only be used in one way. They've got pictures on the front that will tell you exactly where to put them.
Right. It's very simple.
So it's very simple. Once the pads themselves are on, it's going to start analyzing.
So it's front and side.
And the side, we're going to follow the pictures exactly. There are other providers that are going to do things slightly different. In the heat of the moment, they may have a reason. We don't need to worry about that. But ultimately, the machine about now is going to be saying, analyzing, step back, take your hands off the patient.
Right.
From there, it's either going to say shock advised or no shock advised. If it depending on the manufacturer, if it says no shock advised, it will normally say resume CPR, at which point we'll get right back up on the chest, resume CPR. If it wants to shock, now's the time where we need to take a quick look, make sure no one is touching the patient's dry, we're not in any
So
kind
you
of
leave
body
the
of water.
pads on, keep doing CPR.
Until it's time to shock. And when it's time to shock, you will hear an audible tone from your AED, then we'll, again, clear the patient, make sure no one's touching. We'll hit the shock button.
Okay.
You will normally see that big movement we associate on TV with being shocked, where the patient may come up a little. That's fine. That's very normal. At that point, we immediately want to get back on the chest and resume compressions.
Okay. Great. So let's just go through some common scenarios. I've talked about the mall and obviously doing all those things. Luckily, in public areas, you can get fairly rapid response, but you got to say, let's call 911, because then you can get somebody quite quickly, and then you'll get an experienced team, and then they will take over.
Correct.
And even as a physician, I've done that several times. And once the paramedics come, it's their game, as long as you tell them exactly what you did, and then they take it over and they can start IVs, like you, right?
Correct. You mentioned an important part. Make sure someone is calling 911 if you have not done it yourself.
Right.
There are so many emergencies that happen. Everybody gathers around to watch. Everybody assumes someone else has done it, but no one's actually done the basic step of dialing 911. And as crazy as that sounds, it just doesn't happen
at North Park.
So we've got to make sure that step happens. Now, if it happens at a mall like North Park and someone brings you an AED, the other good news is more than likely that security guard or that person is also trained in CPR, so they can take over compressions. They can help you. If not, if you don't have an AED, it's time to start looking at other, what you call maybe an able-bodied individual in the crowd, someone who looks like they served in the military, someone who looks like they could be a police officer or a firefighter. Sir, ma'am, can you come help me do compressions?
Right.
This is all I need you to do. And again, we need to call 911. If we're on speaker, it will give you, many dispatchers will give you instructions on how to do CPR effectively.
Okay, let's go to the other spectrum. You are out and about, and you are running on a trail, and you find someone that's down, that just fell down in front of you. There's nobody there. So what do you do?
In that case,
obviously you probably have your phone, but
yeah, number one is going to be communication. Do I have cell phone signal?
Yep.
Again, I'm not a big trail runner, hence I've got the belly I do, and I'm not very heart healthy. But we need to communicate first and foremost. Make sure we're getting help. Get good directions in a case like that. If you're on a trail or in the backwoods somewhere, communicate your location so professional rescuers can come help you as quickly as they can. Having said that, it's going to be the same assessment. I don't know what those statistics are of trail running cardiac arrest. I wouldn't think it's very high, but there are many instances where someone climbing falls. I know of a professional rescuer actually who recently had a 30-foot fall, tore up his leg, tried to walk out, realized he couldn't, crawled to a point where his sat phone would work, called for help, but his first thing was location. And then he talked about his injury, because you've got to get help on the way.
Right. No, that's smart. What about car accidents on the road? So you see a car accident, and what do? You're the first responder. You're the first one there.
Yeah, my advice is going to be a little bit differently. I'm going to talk a little bit differently from what I do, from what I think the layperson should do. I think the layperson should call 911 immediately, but by and large, I don't encourage the layperson to stop in the middle of a highway. If it's a medium speed road, we can have a conversation if you want to stop beyond the accident.
Or a rural area.
But by and large, there are a number of professional responders who die every year, whether they're police, fire, or ambulance workers, who die on the side of the road because of other careless drivers. You have an initial accident, they stop to help, or they're in a rescue vehicle, and they still get hit. It's perhaps one of my more famous career events, if you will, but we had a 6-patient, 2-vehicle accident in rural Texas, I want to say in 2010. So we ended up having to bring in, because we were the only ambulance there, 2 medical helicopters.
Wow.
To respond into the event. The first helicopter that landed was hit by a 3rd vehicle.
On the road?
Yes. The initial accident was initiated by a DWI driver, but a second DWI driver came into the incident and hit the helicopter with the blades spinning because he was so drunk. Bad things happen, again, in the professional rescue community. Having said that, and let's be clear, we took a number of precautions to try and avoid that.
Wow.
So therefore, the layperson, I really discourage, call 911, get some people on the way, do not get yourself hurt, because if there's 1 or 2 patients, we've now added to it if you get hurt as well, while you're trying to be a good Samaritan trying to help out.
Right.
Use your phone for what it's made for, call 911, give them a good address if you can. Is it northbound or southbound Interstate 75? Often directions like that are critical so that we're not spinning our wheels going the wrong direction.
Okay, great. Well, incredible advice here from Chris on Heart Month, St. Valentine's Day. Save the life of one you love. So, Chris, tell us your 5 take-home points for someone that really has. I've learned a lot from this segment. Tell us the 5 things that you think everybody must know, no matter who you are. I mean,
Sure.
obviously, you should learn CPR, right?
You've got to learn CPR.
Yeah.
Again, we're all looking for the right gift for our
Right.
loved one for Valentine's Day.
Right.
This is a good one. Go take a couple CPR class.
Yep.
Because statistics show that if you have to do CPR and you're not in the healthcare community, more than likely it's going to be on someone you love, either
Right.
a child who has an accident or
Right.
someone else in the family or a friend.
Okay, so learn CPR.
So that'd be number 1. Number 2, if you're going to do CPR, you do not have to put your mouth on a patient anymore. Get comfortable.
Very important.
Work on your upper body. We're all doing New Year's exercise programs. Make sure you're comfortable doing CPR and just taking that first step to act, because that first step is the most important one.
Right, and call for help.
Call for help is always going to be right there with it. We're going to call 911, get both professional rescuers on the way with a good location, but let them help you so you
Right.
don't have to worry about making the right move, taking the right steps. Let them walk you through it.
Right, and then obviously get help. That's number 4,
Get
really
help.
important.
Absolutely.
Okay, and probably the last is, take care of yourself.
Take care of yourself.
Right, because that's very important, because, you're their conduit to life until
Absolutely.
somebody arrives, right? So, wow, Chris, thanks so much. That was absolutely amazing and highly educational. So tell us what else you'd like to hear, comments on what we've talked about. Obviously, these are really life-changing events and really things that each one of us can do to help those that we love. So tune in, and obviously Rohrich Knose is helping you become a better you and a safer you, and hopefully to make sure that you can save someone you love. Thank you so much.